I'd like to introduce our next panel. I'd like to invite up Dr. Sid Gicheru, who is in private practice in Dallas and has been the past president of the Texas Ophthalmological Society and is heavily involved with OFPAC and Surgical Scope Fund. We have Dr. Paul Sternberg, who is the chair at Vanderbilt Eye Center and is a past president of the American Academy of Ophthalmology. And we have Dr. Moroi, a glaucoma specialist at the University of Michigan Kellogg Eye Center. We work side by side with ophthalmologists all the time, and we hear about interactions with optometry in the community, but let's hear from some experts in the field. So Dr. Gicheru, you have a private practice that employs optometrists, but you also are a heavy advocate for ophthalmology. How do you balance that, and can you give our audience a little bit of history about your position?
Currently, we have 3 MDs and 2 optometrists, and it actually works out really well. Earlier in my practice, when I first started, I opened a satellite office and didn't think that the financials actually worked up to bring on an ophthalmologist. And so early on in my practice, I brought on an optometrist. And we put the optometrist in a satellite, in a way maybe thinking they could almost replace MD, and that did not work at all. The way we have it currently, the optometrists actually work as physician extenders, and that really works fantastic. It allows me to be able to be more efficient. It also allows me to be able to actually focus on really what I want to do, as was discussed in an earlier panel. And so for us, it actually works very, very well. I feel that with optometry, you, one, have to treat them with respect. 2, you also have to make sure that you're communicating with them properly. But I've actually been able to actually work it out well.
Dr. Sternberg, in your position as the past president of Academy and in being a very strong supporter of ophthalmology advocacy, how do you balance that, and have you ever faced any backlash from the optometrists in your community?
The challenges, there certainly are scope of practice challenges, and on the other hand, optometrists do see a large number of the patients that we want to take care of as ophthalmologists. So finding that balance is something that you are going to have to figure out in your practice. We employ 5 optometrists at Vanderbilt. When I interview each one, I explain to them that we are an ophthalmology practice. We want them to work with us. They'll have full faculty appointments, but that doesn't involve any discussion of scope of practice expansion. So if they want to do that, they can't work for me, quite honestly. I can't have any of them going down to the State House and testifying against us. It turns out that there are a lot of optometrists who have no interest in scope of practice expansion and are very glad to work in a setting and have a collegial relationship. We also have satellite offices where our surgeons go to optometrist offices, and we have considerable referrals from optometrists. But saying that, there's no question that there is a subpopulation of optometrists in both communities, Georgia and Tennessee, where I practiced, where I probably, they play pin the tail on Dr. Sternberg at their kids' birthdays parties.
If you actually look at demographics, we know that the population of the baby boomers is actually increasing, and really in a few years we're going to be at a point where there's really not enough ophthalmologists to actually take care of all the patients. So I really think that in the future we're all going to have to work in teams of MDs and optometrists, but the key is the MD really has to be the leader of that team.
Dr. Moroi, can you tell us about your relationship with your optometrist at Michigan?
Yeah, so I've been at one institution since 1994, been there a while, and I'll never forget when I brought to the faculty, because I knew it had to be discussed and I knew what the answer was going to be, my participation in Indiana State optometry education for 4 hours on therapeutics. So this was in 1995. I knew I was going to say and graciously say, no thank you, I cannot do this, because the expectation of optometry was that was going to be their education to be able to say they would be able to have privileges to write prescriptions for medical care in glaucoma. So we've come a long way right now. Our practice is one, like Dr. Sternberg, is that we do employ optometrists at University of Michigan with the understanding that, number one, patient care comes first. We work on teams. I did incorporate an optometrist to work with me because I've heard in the prior session, or 2 sessions ago, about how do you break up with a patient when they're stable? And that issue of continuity of care with the referring eye physician or optometrist is very important. When those patients want to stay within your system, or they have grown up in your system, but they're truly quite stable, what I ended up doing is talking to a lot of other experts in the field. What I ended up doing was taking on an optometrist who did end up having an optometry residency. She was very good. She ended up doing a mini fellowship with me for approximately 6 months. In the transition then for her to have her independent clinic, we had clinic on the same days, and we would do post-rounding on the patients. And then I always made sure that I was available for her for any patient questions. Since that time, actually a couple other of my glaucoma partners has asked her to do the same thing. So it's a matter of investment of you to make sure that you know who you are working with, to make sure they're high quality and make sure you're on the same page.
When you're starting out as a young ophthalmologist, what are some key principles in raising that level of collegiality with your community of optometrists?
Go out and meet the optometrists and the ophthalmologists in your community, okay? So that's very, very important. You can take cookies, as was alluded to earlier, but take them something and then just go meet them. The other thing is also, again, as was said earlier, make sure that they have your cell phone. I always do that for my referring doctors. And again, make sure that you're communicating with them regularly. So we always make sure that we send letters to the doctors when we get a referral. And then a lot of times, especially optometrists in private practice, they really do want their patients back for their glasses prescription after cataract surgery. So we actually keep a database in the office of all the different optometrists that refer. There's some who want their patients back for their glasses prescription, others that don't. If they do, then we make sure that we send them back to them.
The issue of spectacles is very precious to our optometry community. And if you can have a practice without your own optical shop, that's really key. If you have an optical shop, it's going to be very difficult for them to want to send patients to you. And there certainly are a lot of practices that do. Well, the optometric community is, just like all of us, are desperate to learn more and improve their level of practice, and they're very welcoming. They really very much would like us to provide care. There's a little bit of a fine line, because you want to make sure that you're just giving education within their scope of practice. And so, whereas it might be appropriate to talk to them about complications of medication and dry eye, but to start talking about laser techniques or advances in surgery where the goal is not necessarily to get the referral, but to teach them. There are lines you can cross. But inviting them to your continuing education courses that you give at your institutions or that your state society gives is something that I think is positive. I know that it's been hard for state societies to think about inviting optometrists to attend, and I think it's something that's worth further consideration.